Everybody, I'm doing a quick podcast today to basically run through all the upgrades that are coming to you with 3.1. There've been a few that have been added to help the system move a little bit quicker and to reduce delays. So I'm going to move through them fairly quickly. If you have any queries, please ring through to any of the team at OHI International. First thing that we've added, when you add a new patient, you will see now that there are more exclamation marks than there used to be. This is very simply to make sure that the data that you enter is complete. Beforehand, we were missing data. Because it populated automatically to gender or to shoe size at a 2, we were missing that. Files then went into clarification, created delays. So what we've now put in is a need to populate each and every one of these. That means that nothing gets missed. It means whenever we get an order through, we don't have to call you for clarification. The next bit of this that has changed is that your email address has been added up at the top here. So we would advise you to please put email address in for every patient that you see. The reason for that is because we have created a link from this email address to the report. And it means that whenever you show the patient the report, it automatically offers to send the report to the patient. So this is one of the biggest marketing tools that you can have with this system. When you scan a patient, when you show them the report, and then when you exit the report, and that automatically goes to the patient's phone or to their iPad, they will show people that. They love telling people how bad their orthotics or their feet are, their biomechanics are, and that will generate a lot of referrals for you. So that's something we have done just by putting in a link. We haven't made it a compulsory one. Obviously, some people don't have an email or don't want to receive a report, but we would say that you should try to put it in wherever possible and whenever possible. So that's a very simple addition. We've just added a few more compulsory fields to make sure we don't lose data or miss data, which delays orders. The second thing that you'll notice is that when you come along the top to the exam findings is the main difference to the software. What we want to do is to create enough information that when you send a scan to us in the lab, that we are able to use that information effectively to create the best orthotic possible. And for that, we need to know a few very simple things. We need to know what the pathology is, we need to know what the pain is, when it's sore, but we also need to know specifically when or how much the big toe can bend non-weight bearing. Okay, so that's why we have two fields in here that are compulsory fields now. They're not compulsory if you're happy to go in and put your own prescription in place. They're only compulsory if you are asking for a clinical review or if you're asking for lab's discretion on an order, because both of those fields both of those things require the clinical team to physically go into the records, look at what you have entered, and then make a call based on the information that you've input. The ability to bend the big toe non-weight bearing is very, very important. It will tell us whether or not the foot is capable of moving in the sagittal plane, or whether it has to externally rotate, or whether it has to compensate. So that's very important. The second thing is primary shoe worn, and the primary shoe worn is not, it's not the shoe worn maybe for 2 hours in the evening. We're talking about if somebody wears a work boot for 10 hours a day, that's their primary shoe worn, because we want to be able to choose the correct insole to fit into the correct shoe. So you choose one of these. There's a little bit of a formatting issue with this. This is going to be updated in the next update in the next few weeks, but literally you can choose one of these as the primary shoe that's going to be worn. If you have anything extra on top of that, you can go into examination notes. The rest of the information is up to you. If you want to put it in, more information we get, the better. Arch height weight bearing is great for us to know, because it tells us how much movement there is in the foot, or how much the foot collapses when you put weight on it. And moving from arch height non-weight bearing, it gives us the total amount of weight, or sorry, of movement. Position of the knee weight bearing, is it internally rotated, straight, external? First ray movements are very important as well. A mobile first ray means you're going to get a lot of elevation of the foot and you're going to get a lot of mid-tarsal and medial rotation. Ankle dorsiflexion is very important because, again, if it's limited, the compensation we expect to find there is subtalar pronation. So all of these things are very useful for us. We would advise you to put them in, but we require 2 fields. If you're going to have or ask for a lab's discretion or clinical review, we require you to enter these and you will be prompted to do so. The last thing is the chief complaints are slightly different. They're a little bit more medical in their basis, and they start from the toes and they work proximally. So if it's ankle, you can already move up the chain and you're going to find it goes from sinus tarsi and the ankle, anterior compartment, the shin, tibial stress, IT band. So it starts at the toe and it works all the way up to the lower back. The report, again, whenever we click the report, you still have the option of clicking the report, showing it to the patient, and sending it out to the patient or printing it off using the printer. Beforehand, you had to save that to the desktop. You had to save it as a PDF file, and then you had to send it as a PDF file. You will see here now that print PDF is now, or sorry, send email to patient is now available. So you can click that button and send that to the patient. So this has prompted me to say, please check this patient's email. So when I go back in, what I will find is that there's no email address here. So that's so I've just stick an email in. I'm going to save and close that. Now, if I go back to send email to patient, that will automatically send that email. Okay, so the report is sent to this patient. And that's a huge marketing tool for you. Just by putting in that extra little bit of information initially, show them the report when they're in the clinic, and then it automatically sends. But make sure you have the email entered. Okay, so clinical review. The clinical review has changed very slightly. It used to be that you got a callback as default. The default has changed to an electronic message. Now, the reason for that is because when you request a callback, it means that we will call you whenever we get to your scan in the queue. But very often as practitioners, you're treating patients all day. So when we try to call you, what happens is you're busy with a patient. When you get out from your patient, you call us and we're busy with our next customer. And we end up playing phone tag all day, even for 2-3 days. Electronic messaging is a little bit more concise, and it means that you can send us a message with your examination findings attached, and our clinical team will look at it. They can act on it, and they can get you an email back. And normally it's very quick. Normally we're talking, within sort of 4 or 5 hours, you're going to get a response to that email. But again, you have to have your exam findings attached. If you don't have exam findings attached, you will not be able to send this, and it will give you a prompt to say, please fill in or complete your examination findings. The reason for that, again, is we can give better, more informed decisions and information to you if we have more information. So the more information we get, the easier it is for us to give you the best possible treatment. The final sort of piece to the upgrade is in the new orders. And again, nothing major, but you'll all be aware by now that there have been some changes to the products. Some have been removed. There's ski flex or skate flex. Dynaflange has been removed. Added to it, we have a performance sport and a performance dress. So it's a carbon shell, which has been added to the product list. So it has brought the product list down a little bit. but it hasn't diminished from it. When you choose your Superflex, again, as before, you click next, you choose whichever top cover, you choose whatever thickness of shell. And at that point, you can select your own. If you hit select your own, you don't need to have examination findings clicked. Because you're putting through your own prescription and it's your own prescription we're building to. If you hit lab's discretion, then it will move through, but it will only allow it to move through if you have completed the examination findings. It takes you through to this page. And again, this is something that has been upgraded in the past. If this hasn't upgraded to your software, well, then you'll notice that there are more choices here than there were in the earlier versions. So it allows you to say that you're going to send a foam or plaster with the scan, or a shoe with the scan, so that you can fit the insole to the shoe, or you're going to send a scan cast 3D or an iPad 3D, or you're going to order footwear with the scan. So all of these give you lots of different options that you can click. Additions and additional order notes, anything that you want to put in, anything strange or different that you want to order, you put it into the additional order notes as before. That's always been there for you. One thing I would say is anybody in Europe, do not hit the rush order, because we already get insoles sent to us between 3 to 5 working days. They can't make them any quicker for us in Canada. If you want a rush order, a specific rush order, ring our office, because the girls in the office will be able to help expedite that for you. So ring Megan, have a chat to Megan, and she will make sure that the order is rushed. We will manufacture it in the Ireland office for you. Those are pretty much the major changes that you're going to see. There's one other option, which is whenever you first go into the system, it tells you to please back up your database. And again, that's super important, because lots and lots of people lose their databases. A third of the problems associated through IT are databases that have been lost. And the more information you have, the bigger a pain that is. So you should be backing up your database once a week. And when you go to close, it won't let you close out of the system straight away. It wants to take you to here first. Again, it'll say, remember to back up your database regularly. Okay, it tells you click on setting menu on the lower left. When you click on setting menu in the lower left, it takes you up and you can back up your database. You can restore a database, check for updates, and update your license. So that is really all there is to the new update or upgrade. It doesn't sound like much, but it really is a lot for us specifically, because it allows us to get a little bit more information from you. It means that we're not going to miss information where we receive scans that are size 2, even though it's clear that they're a size 8 or a 9 or a 10, but the default was set at 2, and we're getting a size 2, and we have to call and find out what the real size of the patient's feet are. So we're removing lots of the clarification issues and speeding up the process for you. And by adding the examination findings, more information you add, then the more information we have to provide a better service for you. Same with clinical review. More information in exam findings, more information for us in clinical review. And also, having an email response is not a negative thing. An email response is one of the biggest positive features we're trying to push forward this year, because it will give you a much, much faster service, but also it is not disruptive to your clinical time. We're not trying to pull you out of clinic to make a call all the time, and you're not trying to step out of clinic to call us. It's also more concise. There's less chance that what we say will be misinterpreted. So it's much easier to take an email and be able to to take the data out of that email. So I hope that helps everybody to understand the changes. If you have any issues, any problems, or want to go over that in any more detail, please contact Dan Crooks or Irina in the office in Northern Ireland. The numbers are obviously 028-867-47074. Thank you.